Hi, and welcome to this edition of the Collaborative Corner podcast. I'm Zach Bernard.
And I am Brianna Barrow. We are your hosts of the Collaborative Corner and happy to have you with us here today.
The Collaborative Corner is a production of the Fort Wayne Media Collaborative with the goal of connecting listeners to the stories and culture of Northeast Indiana.
Through this podcast, we want to bring you the full context of our region by speaking with notable people in local entertainment, government, food, you name it.
Joining us for today's episode is Rachel Blakeman, Director of PFW's Community Research Institute. Rachel, thank you so much for being with us today.
Thank you for having me.
So Rachel, could you tell us a little bit about yourself and your experience, and also just explain to us and our audience what the Community Research Institute is?
Sure. Well, I've been the director of CRI, the Community Research Institute here at the PFW campus since July 2017. So I'm coming up on, 7 years now? So we do contract-based research and analysis. When I started historically, CRI had done a lot of economic development and workforce development work. Under my leadership, for a variety of reasons, we transitioned, and I now do a lot of work with local nonprofits. I also do some work with government, specifically county and city government. I've gotten into the business of grant writing, so I've had the opportunity to earn some competitive grants for some of my clients. So that's been incredibly rewarding. Working on a couple right now, so love that challenge of being able to bring federal and state funds here to Fort Wayne and Northeast Indiana.
It's a clean transition to the next question. How does the city use the data that the Community Research Institute produces, and does the Community Research Institute use that data to track issues like poverty and access to affordable housing?
Sure. Well, so when I think about the research that I use, I have a strong preference for using government data. And people are always like, well, why do you want to do that? And I actually say because of the fact of its completeness, its reliability, and the public accessibility. Now, there are reasons to use private and proprietary data sources, but one of the things I always like to point out is if you notice coming up in the week between Christmas and New Year's, U-Haul almost always puts out a news release talking about the cities of where people are moving to and from. And they do that with the data of people who rented U-Haul trucks. However, that's an incomplete data set. Think about it. We have Serva downtown. They're nowhere to be seen. All of their clients are nowhere to be seen in that data set. So when we think about it, I would much rather use information that either comes from the state of Indiana or from the IRS that has a much more complete and more comprehensive perspective on information such as basic as where people are moving to and from. In terms of poverty data, that information comes from the U.S. Census Bureau. They're really my go-to source for almost all population and demographic information. Part of the game of this job is understanding what's available, where it's available. Rachel's rule of data is what looks obvious is probably not available, and what looks incredibly obscure I can probably find at my fingertips. An example I like to give is people often want to know about entrepreneurship. They're like, well, tell me how many women entrepreneurs we have. And I'm like, good question, I'd like to know too. I literally have no data on that. It's not what we collect. However, we have incredible data about cancer rates. We have incredible data about births. And because we collect and track that, because somebody advocated to get that information. For a variety of reasons, we're not collecting that for entrepreneurs. I can't tell you anything about it. So the stories that I'm able to tell and the information I'm able to communicate is limited by what's available to us and what's collected ultimately.
That's really interesting. So a big focus for the Fort Wayne Media Collaborative is affordable housing. So does the data show any correlation between access to affordable housing, as well as other issues such as lifespan, infant mortality that you just said, and overall community health?
Yeah, I'm not sure I'm going to say that there's an actual correlation specifically about housing affordability and lifespan. However, I do know that our lifespan in Allen County has an incredible spread. So there is actually pretty good data available from the CDC, and I looked this up. So for births between 2010 and 2015, census tract 116.07, which nobody knows where that's at, but it's actually southwest Fort Wayne, had a life expectancy of 86.8 years. That is longer than Hong Kong, which is, it's called a country. Yes, I know it's part of China, but for this purpose, let's just consider Hong Kong separate. That was 85.49, so that's the longest in the world. And then if we look at Census Tract 17, that's in southeast Fort Wayne, that had a life expectancy of 66.9 years, which is shorter than many countries in either the global south, Central America, or even Mexico. So if we think about that, there's an incredible division of the socioeconomic factors within Allen County. So what I would say is that inequity comes from a variety of factors. So if we're thinking about it, it's everything from income, education level, which often drives income, our housing choices. Think about our neighborhoods. So do you have accessibility to sidewalks? Do you have sidewalks you feel safe walking on because maybe they're not in good condition, or you don't feel personal safety because of concerns about crime rates, things like that? What about things like such as your social connections? And we actually find that that's not necessarily something that's particularly driven by income. Sometimes people who have relatively low income have very strong social connections. Higher incomes may have fewer social connections. And then ultimately, if we look at it, of quality access to quality health care, and then our health behavior. So all of these things come as a confluence of events. And so I'm hard pressed to separate one from the other because they often build on each other.
City leaders here love to talk about how Fort Wayne is an affordable place to live. Does the data that the Community Research Institute support that notion? How affordable is Fort Wayne when considering median income and cost of living?
Yeah, well, that's a lie. So in some ways, depending on how you measure it, we actually do have a strong low cost of living. However, it's offset by our even lower wages. So I pulled the information. So what's called there's multiple cost of living calculators. The one that I use, government data, is the Bureau of Economic Analysis, BEA, and it's the Regional Price Parity, the RPP. So I looked this up, and so what it is that so the most recent one, this was in 2022, our cost of living, now, in a complexity, it does not include cost of living for owner-occupied houses in terms of your mortgage. It does include rentals. We'll talk about that in just a moment. So the Fort Wayne MSA had a cost of living of 92.7 cents on the dollar. So we're saving, like, what is that? 7 cents. 2023 data is going to come out in December of this year. There's a huge data lag on that. And also when we look at it, interestingly enough, when we talk about housing affordability, we're still an incredibly affordable housing market for renters at 79.5 cents on the dollar as compared to the nation. Sit tight here. So then if I look at the average wage in 2022 in Allen County, the average wage, now this is a true average, so we take all of the wages divided by all of the jobs. So we're including part-time work, all of this, was $55,896, so about $55,900. The national average was $70,346, so about $70,300. So that means that our average wage, we are making 79.5 cents on the dollar. Okay, so let's run the math again. We're making about 80 cents on the dollar. Our cost of living is 92.7 cents on the dollar. You don't have to be a math major to figure out you are not getting ahead in Fort Wayne on these measures. Now, are there some ways to do this? And I've had debates with people about, like, well, can't you live cheap here? Yes, you can. But the fact is that collectively speaking, our affordability is not what it once was. So when we think about it, that, and these are the average wages, these are private sector wages. So I do want to say that actually the story that we told ourselves about being a low cost of living city was actually relatively true in the late 90s, that our average wage was much closer to the national average. And I've run the numbers and I do the adjustments for inflation and all these kinds of things. And so our number has kind of crept up incrementally, and the line of the average wage nationally has had a sharper curve to it. So we're not competitive on a national wage scale. And I think that's actually one of the challenges that we have, and we're seeing that specifically right now. So when we think about it, of inflation is hitting everyone. It's very difficult to escape. You can use substitution. So I was just seeing a story online of like, she can't buy bread anymore and she makes it at home. I'm like, that's exactly what we do in substitution. We replace things. She was like, I can't afford olive oil, so I buy vegetable oil. Bingo, substitution. But what it is then it means that there's just fewer dollars floating through the economy. So you want to support your local bakery, you want to support your landscaping company, you want to support a photographer. All of those things are just fewer dollars floating through the economy. And we don't talk about that enough. So I'll keep talking about it until I don't have to talk about it anymore.
So in what ways have other cities worked to close the gap between income and cost of living? And have we seen Fort Wayne implement any or implement anything similar?
Yeah, I mean, so if we think about it in terms of cost of living, that part of the reason why we have a lower cost of living is we have lower wages. Part of the reason why our house prices are lower is because we don't have that price escalation because there's not the dollars to support that information. I'm going to say I haven't seen any city that's really cracked the nut on that, especially around housing affordability. It seems to be kind of a thing we have in the way that, and so I'm not sure that I have a turnkey solution for us. Part of it is then we want to be working on making sure that we are bringing in enough high-wage jobs. I support the position that Dr. Michael Hicks has at Ball State of talking about that the way we raise everyone's wages is we make sure that we have more college graduates and more jobs for college graduates. That's how you raise everyone's wages.
That's really interesting. Sorry, I'm just
sure, no, that's all right.
For a second. Interesting. So this might be a little redundant, but access to affordable housing stock, or rather lack thereof, has been identified as part of the reason for the affordable housing crisis happening everywhere. What does the data show about Fort Wayne residents' access to affordable housing units? Has access trended up or down over the past 5 years? And has Fort Wayne seen any meaningful change as a result of the added housing stock downtown?
Yeah, so a couple things here. So first of all, increased wages make housing more affordable for folks. And so now there is some concern about what they call the wage price spiral. So that as your wages go up, the prices go up, and that measure, and we've seen a little bit of it, but we've also seen that inflation isn't where it was 2 years ago. So housing affordability has trended downward in terms of, so if we think about it, there's a couple ways there are multiple ways to measure housing affordability, but one way to do it, and we'll use it for here, is the Association of Realtors, Upstar, publishes monthly data, and so I pulled that. So let's just talk about a few pieces of information. So in April, as of last month, we're recording this at the end of May for folks, that April had 1.3 months of supply. So typically you want to be kind of at 4 to 6 months housing supply. So we're still distinctly a seller's market. It's gone up a little bit. It used to be less than a month, but we're still at that. What's interesting is that the median sales price in April was $249,000, and that is up from $248,990. So about 200. So it went from $249,990 up from $248 a year ago. So then if we think about it, then they also do wonderful numbers, and so I like to use these data sources, and they publish it. So these are about a 6-county area that they serve. So they do a housing affordability index. The higher the number, the more affordable it is. So we were 118 compared to 128 a year ago. Let's walk back in time to 2013, where people were starting to talk about the lack of available housing. So it was not pre-pandemic, whatnot. And we had a housing affordability index above 300 for a few months. So you're starting to see, this is a number that no one talks about, and I think it's a really key measure. I'm watching to see if and when we cross over to below 100. So what they do is they take median housing price combined with the average interest rate and median household income. They do the numbers, I just talk about them. But it's a really interesting thing. So one other thing about housing affordability is we want to be thinking, so I tend to talk, in this context, I'm talking about people who are earning a wage, having a paycheck, whatnot. But then if we think about people who have income constraints, so they're living on Social Security and a pension, they're on disability, and that's a different conversation because it's less, how do we work on that? And that's probably a conversation for another podcast for you. But also when we think about housing affordability, what is affordable housing? I remember that Mayor Tom Henry sometimes talked about it because housing affordability, often when they hear that, they think Section 8. of a subsidized housing program. And he would talk about that it should be housing that is affordable. And so when we think about what is housing affordability, what we want to be, the calculation is that you should not be spending more than 30% of your gross income on housing. So when we see that, and I don't have the numbers right here in front of me, but we know that specifically for renters, and this is across the board, Fort Wayne, Allen County, Indiana, and the nation, renters are actually the most income constrained or housing constrained when it comes to housing costs, that they're often exceeding that 30% threshold. Homeowners actually don't, at least in Fort Wayne and Allen County, have historically not had that problem. Part of it is you've got a mitigating factor of you have to get a mortgage, and they're much less likely to approve you for a mortgage that is going to stretch you, at least locally. And so I think that's a very interesting conversation when we think about housing affordability, is it's really running those numbers against household income.
We know that Fort Wayne's southeast quadrant has historically been known as one of the areas where it's been a challenge for residents to access safe and affordable housing, as well as access to fresh food and other amenities. Is there any data to show where southeast Fort Wayne is compared to other areas of the city, and what are the differences between the southeast quadrant and other parts of Fort Wayne? Is there any way we can use that data to see how this part of town has changed over time? Yeah,
well, so the credit goes to the city of Fort Wayne for putting out their Southeast Strategy Report. And I think it came out in like 2022, I remember correctly. So I've used that for other projects that I've had, and so I had an opportunity to pull some information from that. So if we look at it in 10 years, so approximately 2011 to 2020, there was $25.5 million in new residential construction. When we compare that to Northwest Fort Wayne, that was $92.8 million. So, I mean, that is a factor of almost 4 on that. We see similar patterns for commercial development. So it wasn't just that we weren't building new houses in Southeast, we were not investing in commercial construction on that, and also similar things for maintenance and repair spending. So if you think about it, like getting new roofs and things like that. So then when we think about food access, and I want to bring this up because I think this is very interesting, when you actually look at the USDA's, it's often known as the food desert map. They have I can't remember what the name of it is. I should try to remember that off the top of my head, but they've backed off from calling it food deserts. But it's about, so they have multiple measures. So one is the distance to a full service grocery. So actually, when you look at the map, we do know that they never publish the list, but if you look at the map in Fort Wayne, you can identify what constitutes a full-service grocery. So George's International is a full-service grocery. The Asian markets, the international markets on Calhoun Street are not, based on the map. And so like convenience stores, gas stations are not. So sometimes they're like, well, they sell a banana, and I'm like, yeah, it's not a full-service grocery store. What we know actually is that if we look at food access, that most of Fort Wayne lives in a food desert in terms of if you're more than a mile away, because they do it in a half-mile measure and a mile. And so if you look at it, you can run either one of them, and there's a lot of it. And so what's interesting is, because I'll hear people say, well, we need a grocery store in every food desert. And I'm like, well, actually, you already have it. 2 of our Meijer stores are located in food deserts.
Wow.
I know. So this notion, because again, it's the way, so there's a factor of distance and then income. So share of low income residents and the distance to a grocery store. And 2 of our Meijer stores have been, and I think they still are, in food deserts. And so that means, because of census tracts are very small, their census tracts are designed based on population density and the number of people. So downtown has 2 census tracts. Other census tracts are incredibly large. So the Lima Road Meijer is a food desert. And so because of the way the census tract is drawn, it goes to the west. So it's Lima Road west to Hillegas. And so if you think about it, you've got some locations there with some low income populations. And so they're more than a mile away from the Meijer, because of the way that, I know. So that's one of the interesting things about this, is that when you start to look at the data, you start to come up with different perspectives. I mean, so I obviously have my own, like Rachel Blakeman, private citizen, has opinions. But my opinions as the CRI director are driven by data, and the data changes things how I see it. And so I speak from the data.
Can the data help us identify solutions to the issues of access, like food, affordable housing, and other community amenities? How can this data help city officials and advocates move towards solutions and change? And is there anything from the data that sticks out to you as something that has moved the needle in the past?
So I think one of the things to remember about Southeast Fort Wayne is they're not looking for something special. They're looking for what everybody else has. They're looking for safe neighborhoods. They're looking for quality schools. They're looking for housing options. So I think sometimes that there's this notion that they want, like some people are like, they just want something special. No, they actually want what Southwest Fort Wayne has. And so if we think about it in that way, about wanting available jobs, they want places to spend their money. We like having things nearby to us. That's what people like. And so they're looking for the similar things that already exist in Southwest Fort Wayne, off of DuPont Road, things like that. They want to have those options. And so how do we do that, and how do we accomplish it? What I'll say is that the Southeast Strategy Plan has some very good data in there, and it allows you to make comparisons of Southeast Fort Wayne to the other 3 quadrants. And so for an example, that the Southeast median household income was $28,972. We take a look then at Southwest, more than almost double that at $55,608. So we can see that there's incredible disparities. But think back when I was talking about the census tract in Southwest Fort Wayne that had a life expectancy longer than Hong Kong, and then locations in Southeast Fort Wayne that we're going to be looking at having life expectancies lower than countries in Africa. So there's incredible disparities.
Before we conclude this conversation, what should viewers or listeners know about the Community Research Institute?
Yeah, I mean, so I think there's a couple things that when we think about solutions, that one of the challenges that we face is how we appropriately scale. And so it's not to, I mean, so if you know the starfish one of like throwing the starfish in, and it doesn't, there are all these starfish out there, well, it mattered to the one starfish. And that's important, and I don't want to dismiss that, but also some of these problems are on pretty significant scales that were built over decades. And so this notion that one program in 3 years is going to be able to solve it, or that also our problems are typically not unique to Fort Wayne. It's not to say that we don't want to look to other communities in terms of how to solve that work, but we also have to recognize that there's a lot of these problems are kind of baked into the system, and so there's not, if there were an easy solution, we already would have figured it out.
Rachel, thank you so much for coming in and speaking with us today.
Sure, thanks for having me.
We'd also like to thank Fort Wayne Media Collaborative Project Manager Dave Gaughan for coordinating this episode of our show.
And our thanks, of course, to the college TV staff here at the Center for Collaborative Media at Purdue University Fort Wayne. If you are interested in more content from the Fort Wayne Media Collaborative, please visit fwmediacollaborative.com.
Until next time, I'm Zach Bernard.
And I'm Brianna Barrow. Thank you for listening.